Let me just get to our, everybody see the PowerPoint? Yes?
Yes.
Yes.
Okay, great. Okay, so welcome everyone. So we have a collaborative presentation today. I won't do all the talking, but we do have a hefty agenda. So I know there's been some confusion, but we will go through our points of contact as always. We always do a little restructuring within the department. So I will touch on our workforce team and who that is. And I'll pass it on to our workforce coordinator, who will talk about, the workforce members and their responsibilities, who does what, so you know who to contact for what on that side of the SDS team. There's been within the workforce team, there's some also tasks and changes that we want to ensure that as brokers, you all know, as we do tend to ensure we CC you on all matters or most matters. We try to, remember as much as we can to do that, as we should. That's our best practice when it relates to matters, with self-hire employees and, their PTO. Oftentimes, we'll have families or employees email us directly about things, and we try to remember as best we can to ensure that we always loop you into those things. So we always want to tell you first, or at some point, things related to that. So we'll touch on workforce matters, work for the broker compliance reviews and quality assurance. We're going to touch a little bit on what we're looking for in that area.
Jen?
We have, yeah.
Sorry, we see the PTO request, not the PowerPoint.
Thank you. Thank you. I'll stop sharing share again. Then we have our senior FI manager right there is gonna touch on staff action plans, monthly summary notes, as part of our presentations today. Do you see that meeting agenda?
Yep, now
Yes.
you're good.
Thanks. SDS policy and procedure updates, some brief updates, but we want to highlight that real quick. So we'll distribute the link to that as well. Family reimbursed respite, the claim form, we did revise that in March and distributed that, but I want to highlight that here too. Project management updates, we'll pass that on to Grace, our project manager. We did kick off family meetings this month with a steps 2 presentation, and we'll wrap it up with a Q&A. So, okay, next slide. But firstly, I do want to highlight our CPO, Linda, with her recent IAC Leadership Award. For those that are not familiar, the Interagency Council is someone we've been it's a council we've been affiliated with many years. What IAC is charged with is they're essentially a wonderful pioneer they're affiliated with many organizations and serving individuals with intellectual and developmental disabilities, and they advocate for change. They help in organizations like us and many other nonprofits in strengthening leadership, advocacy efforts, funding, grants. They support us essentially in unifying and bringing a strong platform. They're an asset to organizations, and Linda, for many years, has been a strong influence and leader. She sits in just about 1,000 committees, IAC being one of them. And I can't tell you how huge of a deal it was for her amongst many organizations and many candidates to have been, been selected as the winner this year for that award. So I really wanted to highlight her for that here. So congratulations to her on that, and on her true leadership and presence in the self-direction realm, and working side by side with us all in really what I personally believe is a true person-centered leadership and self-direction. So cheers to Linda for that. And while I'm on this IAC, this reminds me, fresh out the oven. I don't have it on the slides, but more to come. As IAC is supporting us with this. Most of you are probably familiar, and I may not be articulating the name so well, with the coalition group. Anyone out there recognize the name? The Families Brokers, the Coalition for SD group of wonderful parents and brokers advocates. I know that in the couple months to come, CFS, we are collaborating with the coalition group to come together. I know that it's been coming where we will come together. We will probably in our main office, we will be hosting a space there for the coalition group to join us and essentially, bring the concerns, point for advocacy and, to just render the points. It's an opportunity, for FIs. We did invite FIs. Just, for both sides to come together and, understand each other's sides, some, strong points to bring to OPWDD perhaps together. We don't have agendas, I don't think, on other sides yet. It's very fresh. So, and again, we don't have a solidified date yet, but that should be sometime in July. So more to come. Okay, but while we're talking about IAC, who will probably help foster that, putting that out there. Okay. So points of contact, that's not much huge changes there, but what I do want to highlight is Faye, Monica, Marissa, who are our senior FI managers. So congratulations to them. And just so you know how that works, so Faye as a senior manager collaborates and works closely with Nikasi, FI program manager, Monica with Sahita. So as an example, if Sahita were out, brokers who work with Sahita, you would contact Monica. Marissa collaborates with Lauren and Maria. So again, congratulations to our senior FI managers. And our workforce team, welcoming Noemi Galvez, first time in our broker meeting. Noemi does come from the community services side of the Center for Family Support. So while she's a newer face to the SDS side, she is already a member of the CFS team. She does come with a wealth of experience in the human resources field. So we are delighted to have her as an asset to this side of the team. In the next slides to come, she will talk more about the workforce structure. And we have Suhana, who's been our program assistant, the Jasmines, as we refer to them, our onboarding specialists, Grace, our project manager, Andrea, who is our quality assurance specialist, Joseph, who is our invoice person, and of course we are backed by finance, payroll, and many other members. So no major changes as it relates to that. And I am gonna pass the next few slides off to Noemi as it relates to the workforce structure. Noemi, good?
Yes, thank you. Good morning, everyone. So just going over workforce and the changes that we are implementing at this time, we did send out a notification out to the families and the staff to let them know the importance of accessing their CFS email. The reason being that if staff does not access their CFS emails within 120 days, unfortunately, their accounts will be deactivated. And that would directly impact Evero and UKG. So we want to make sure that staff is making sure that they continually check their email on a weekly basis to avoid the activations of their email. So that's one of the updates that we have at the moment. We also do want to notify staff and families that they're no longer required to complete the pre-employment physical. So that is a good update because it's one less step that they have to complete. But at the same time, we have added some additional steps to the onboarding process. One of the biggest projects that we're working on right now would be the statewide central registry. This is an OPWDD requirement. In order for us to comply with them, we are required to provide this form to our pre-existing staff and our new staff. This form is just generally for the state of New York. And it's just checking that no one has any child maltreatment or abuse in their backgrounds. We have notified the new staff with this information, and shortly at the end of this month, we'll be sending this out to pre-existing staff. They do have to complete this background. Typically, the background check takes about 2 to 3 weeks to for us to receive the results, but sometimes it can delay the process a little bit. So we just want to make sure that we inform that to the family and staff that this can delay the hiring process for onboarding. Okay. Any questions about that part? Okay, great. So as the workforce team, I am the workforce coordinator, and my main responsibilities are PTO requests, monitoring the allotted PTO. I also work as an HR liaison for direct deposit, non-receipts of pay, or FMLA requests, workers' comp, and any staff availability. I'm also responsible for reviewing and approving change of status forms, employee separation forms. Previously, those were going out to Linda, but that responsibility is going to be transferred over to me pretty soon. So please make sure to reach out to me if there are any changes with the change of status or employee separation forms. I'm also responsible for employee timesheet, tracking one of our other backgrounds, which is the staff drive personnel vehicle report that will be speaking on that once that change goes into effect. And I also oversee the protocols and implementations of manual verification visits. And my colleague, Suhana, was the program assistant. She is primarily responsible for that. She oversees the MVVs, but she's also our point of contact for setting up staff and Evero training. She also takes care of like reviewing any or requests of outstanding documents or emergency entries, and she also does have time that she sets up with staff with any additional assistance in that area. Moving along to the Jasmine, we have Jasmine Peña and Jasmine de la Vega, who are our onboarding specialists. They provide new hires, self-hire staff with the onboarding instructions. They schedule them for the fingerprints. They evaluate all required clearances. Now, one of those clearances is the state registry. So they'll be in charge of making sure that they look over those results along with me and HR to make sure that they're in compliance. They review all self-hired staff documents to ensure the accuracy and completion. They also provide the credentials for CFF emails and UKG accounts, and they assign new staff to employee orientations and annual training refreshers. We are working on changing the platform that we use for the annual refresher. And at the time that we make that change, we'll update you all because we're probably moving that over to UKG. We have also created a workforce email. It's dl-sdsworkforce@cfs.org. That's an email that we are all attached to, everybody in the workforce team. It's just a quicker way to reach out to all of us together in case you're not sure who to reach out to directly regarding any inquiries that you may have. Does anybody have any questions for me? I know I speak a little bit quickly. That's my Dominican side that comes out. Well, thank you everybody for your time. And I'm always here if you guys have any questions or are curious about anything or just need any follow-up. I'm always here to help along with my team. Thank you for your time.
Thank you, Noemi. Yes, I'd say the SDS workforce email would probably be the best bet for, and we'll always redirect the self-hired. And as a matter of fact, you may see more of this if you're CC'd on emails. You will probably see more of a push and consistency from us to the self-hired employees where we're redirecting them to reach out to us from their CFS emails, right? So we are doing more of this now. Usually, they'll text or utilize their Gmails, Yahoos, and we while we were quite laxed with it, we are getting a lot of push from the IT team to ensure that we are adhering to the security and HIPAA and all the things that we should be. So you'll see more of that, where we are redirecting on the workforce side, FI managers, all of us internally in the organization, ensuring that self-hired employees are reaching out from their CFS emails. And another thing we're doing is we're ensuring that they're utilizing the resources that are already there, right? On the web page, there's tons of FAQ stuff, things, pre-recorded things by us, how to use UKG, how to update your address on UKG, how to find your pay stub, things like this already that they can find that can save ourselves quite some time. So my time card on Evero, how do I know if I'm missing hours or not? Should I be doing an MVV form? So these kinds of things that, I know necessarily as brokers, you may not necessarily know, but if you are the kind of broker that may be receiving these kinds of inquiries from a self-hired employee, just know that these kinds of resources are on the web page for them. So you may want to redirect them to that as well. So thank you for that, Noemi. And again, while you will have these slides, you do not need to memorize who does what. The information is there as a resource for you, but best bet is to just have that SDS workforce email handy. I did want to, let me stop sharing because I know it's not gonna just show you. I did want to quickly highlight, and it is already on the web page, on our CFS web page, the employee paid time off request form. The quick change that we did a couple quick changes. The first one is we attached the link to the, oh, I'm sorry, does everyone see the PTO form for self-hired employees?
Yes.
Thank you.
Yes.
Thanks. So we do have the link to the PTO policy form. So what we will try to remember is that if there's updates to the policy form, to always capture that link on the PTO form. It's just a way for the employee to easily have access to that from their PTO form. The second thing that we have is a sick day column. And there's a reason for that, because I'm not sure that employees readily know that a sick day per the policy, and that's not a change, but per the PTO policy, that does not require an individual or designee signature. While it still counts as PTO, PTO does require individual or designee signature, but if they are sick, they're sick. And we will process that time with or without the designee signature per our policy. So this is why we added this box here. And again, and the revision to the PTO policy is just indicating that as an FI and in this co-management model, as an FI, we do reserve the right to approve or not certain things. So we did highlight this in the policy and procedure manual, as well as the PTO policy. So that's what we're highlighting here and in the policy and procedure manual. So those were the updates, but again, we're ensuring that we're including the manual in the PTO form. I don't know if there was a question, but I wanted to highlight this form here. Again, it's on the website, and this is what we'll look for moving forward. And just so everyone knows, the PTO process is the form is completed, the hours, again, it's in the PTO policy, but ideally, easy put, the form should be completed, signed by the employee, signed by the individual or designee. This gets submitted to Noemi. Noemi will ensure that the dates and hours coincide with the person's work schedule. So if the person works Monday through Friday, 9 to 5, that is what the PTO should reflect. The dates and times should coincide with what their typical work schedule is, right? That's what the PTO is. Also, the PTO is not an accrual. It's based on their status, and we will ensure with HR that they have enough time. Okay, so again, it's all in the PTO policy. We're not gonna, take all that time to get into that. It's just useful information, as we know that depending on the type of circle of support and family that you serve, some of these questions may come directly to you first as the broker. Okay. So going back to the slides here. Okay, so shifting into EFI police side of things, the compliance. Not gonna spend too much time on this slide only because we did present the compliance type of stuff that we are starting to do. We presented this in the last broker meeting, and what we were discussing was, we took a break a little bit from referrals and growth, and that had more to do with the limitation, as we all know, of funding. And so while we hope to reopen doors in 2025, when most FIs, renew contracts, we are utilizing the time wisely to fine tune our policies and our best practices and compliance protocols, right? And so in this time, one of the things we are looking at is compliance and how do we achieve that. And one of the things we looked at is this method here. As you know, as the FI management team, what we do is sit typically in life plan reviews. We have our FI manager reviews that we distribute to the entire circle of support, and we follow up to ensure that all parts of the circle provides what is needed to ensure that all things are in order and all is great, right? And when we don't have all the things that we need, then this is where the compliance protocol, we may utilize the support of the QA team to ensure that we enforce these things and have what we need, right? And that may mean that the QA team, in this case, Andrea, may have to, reach out to the CCOs. We may have to, reach out to the self-directing family to ensure that we put some level of responsibility and accountability on them to support us on our efforts of attaining, ultimate levels of compliance. Now, what I really wanted to point out here is what we have been learning in this process, some of the feedback. So in this process here, what we have been learning is that it's actually served as an opportunity to retrain families. What we're finding is that families that may have onboarded years ago, they had, an hour-long launch meeting and signed a whole bunch of forms, an memorandum of understanding, an MOU that outlined a bunch of responsibilities, but but they just don't remember a lot of this stuff, right? It's been quite some good feedback, right? It's been a good opportunity to retrain everybody on their roles and responsibilities as self-directing families. We've connected with specific members in different CCOs. We've ACA, for example, we've identified a resource there, and I point this out for brokers because I'm sorry. Sorry. Oh, okay, it's okay. So, and I point this out for the brokers, for example, ACA, because we may be of a resource to you. And I say this because I know sometimes when we, as FI managers, may reach out and say, "Hey, where's the SAP? Where's the SAP?" Oftentimes, what we hear is, I don't have a life plan or that kind of stuff. And while we understand that, there are ways around that, or we may be of support to you and may have certain resources to support you in getting what you need, right? So there's a way to get things done. You just may need more of our support or connections to get more of what you need. So definitely, have those conversations with us, reach out to us, and any hardships you may be having. Through this process, we are learning, we have found certain connections. We are learning that by retraining care managers or families, or placing a certain level of accountability, or retraining families, that we are making some legway. It's not perfect, but we're making some legway. So we hope to see more of this in the direction that we're going. And with that protocol, we are aiming to also put into place a broker compliance protocol as well. And what that'll look like is, every year, as we know, there's a broker reauthorization, which is, I believe OPWDD sent the email this week for that reauthorization come August. And with that reauthorization, we are required to have that corporate compliance and Medicaid and some of these other things. And don't hold me to all of this. I may be wrong. I'll confirm it though. But I know that, as you know, most FIs will say, hey, we get this list. FIs get this list that'll say, broker authorization numbers ABC are reauthorized or not. And outside of that, though, FIs will look to see that you also have the corporate compliance, the Medicaid, and all these other required OPWDD trainings. I know that some FIs may send you those trainings. We certainly have some of these on the web page already. What I plan to do over the summer, we will be working on just maybe having a simplified Adobe signed document with all of the required OPWDD trainings that are outside of the broker reauthorization that you can probably easily read and sign. So we'll work on having something like that. And with that, your broker policy contract, the CFS broker policy contract, which everyone would have completed that, except if you're a parent broker, everyone would have completed that when you onboarded with CFS. So you're probably, you have to probably be familiar with that. So more to come on that. So we will work on a simplified, OPWDD required training over the summer. That way, and I hope, wishful part of the bucket list, wish list, that it be over the summer so that it's consistent with the broker reauthorization. That's the logic behind that. So now, as far as a broker protocol, our hope is to enforce the terms of the CFS SDS broker policy contract. While I won't bring that up now, some of the things in the broker policy contract really mimics the broker policy contract mimics what's essentially in a support broker agreement, right? Your staff action plans, broker meeting minutes, face-to-face visits. We ensure to include language in there about telehealth. So when you see the broker policy contract this time around, when we create this Adobe electronic type of thing, just ensure you reread it carefully this time. And any questions, of course, or feedback welcome before you sign it, because moving forward, we do want to enforce it in the sense of that. Remember, as we are a larger team now, and as we serve the amount of families that we serve now, and now that we are equipped with a QA team, and have internal audits, we want to ensure that we are up to par, not only with all of the documentation that we need, but with the quality assurance, which I will get into on the next slide, right? So by quality assurance, what do we mean? Quality of staff action plans. Senior FI manager will get into of what quality of staff action plans are. Broker meeting minutes, and evidence of staff action plan reviews. When there are life plan reviews, and we should be, as brokers, highlighting that services and supports are continuing or not, progress or lack of progress. Just highlighting conversations, discussions, and meetings. And there may be trends that these things may or may not be happening. And I don't want to point out this. I'm not saying that we have brokers here that aren't doing this, but I'm talking about across many FIs. These are conversations, I would say, in committees and things that come up. So I want to, I'm sorry, if everyone could just mute themselves. So I want to bring this up in this platform, that we ensure that we are bringing this kind of stuff here, that we provide this kind of narrative information in our minutes, that we highlight these kinds of things, right? And what do these minutes do? they carry on over to our broker invoices, right? It brings the kind of detail that we want to highlight in broker invoices. If we have, let's say, an hour and a half life plan meeting, as an example, because this is an individual that has a serious transition into an adult budget. We are contemplating housing and a move that may be to a different region, and it is a serious and big deal, right? And what is this person going to work now? But that is translated into 3 sentences. You know, the person behind this broker invoice that is reading 3 sentences may say, but was this really 2-3 hours? You know, and then this person may question your job as a broker, and it is to no pun intended, because you guys do a great job, but we don't know this, right? Because we are only reading a few sentences. So what I am essentially saying is, while it is tedious, while it is tedious, it's all about justification, right? And the quality and the quality and the quality. So it is the presentation of our work as professionals, right? So if our broker meetings, evidence of our staff action plan reviews, our life plans, broker invoices, if all of this stuff is consistent and detailed to some extent, you know, to some extent, and it all just makes sense across the board, I think no questions asked, right? Now, a little note on indirect time in meetings. I know that this does come up sometimes, but there is a way around this. I know that sometimes we do get emails from brokers that you can't put in your service documentation because there may have been a self-hired employee present at that meeting, which is fine. Just let us know in advance if you know that, if it's happening, as we can advise the self-hired employee to enter their time as indirect time. But if not, that's fine also. If you do have an issue in putting your time, you just need to let us know, and we will work on entering the self-hired employee's time as indirect time. So there's no concerns there. Referencing current life plans when completing justification forms. Another trend we are noticing and this is if you as a broker are submitting justification forms for classes or whatever kind of justification forms you submit, if you're referencing, you know, in the justification forms, one of the questions on those forms is, you know, what's the date of the life plan and which valued outcome, right? Oftentimes we do see outdated life plans reference, like a life plan, you know, I don't know, October 2023. So when we review this, we're thinking, oh, so there should have been a life plan. I don't know, there should have been a life plan, a more recent one. So maybe just indicate that there was a new life plan or pending being published. It just, you know, you might want to point out that there's a pending new life plan or that a meeting just happened, just to ensure that it's not, that the justification form is not denied over a missing life plan, you know, so that there is a trend that we are noticing there. Just to remind everyone, just if you're a broker that submits invoices on behalf of a family, justification forms do have to be attached to the invoice for classes, or invoices that do require justification form be attached, do attach the justification forms. Also, for maximizing budget lines, we do send out monthly resource emails on maximizing budget lines, particularly for self-hired budgets that either do not utilize self-hired supports or very minimally do so. We encourage you to check those out. And once in a while, when we do receive inquiries from employees looking for additional hours, we do share out those resumes as well. Any feedback or comments, any questions on the kind of things you're looking into for quality assurance? Any Q&A, by the way, on the chat? I don't. Okay. If not, I am Marissa. If you're ready, I'm gonna hand it off to you.
Sure. Let's do it. Okay, so staff action plans. So we just wanted to go over a few different points about the staff action plans that you guys are creating and some friendly reminders that so the staff action plans, they must be in line with the valued outcomes and the goals life plan, right? Because they're two separate documents, but they're about the same person. So we want to make sure that they match, right? The care manager is going to put the valued outcome, but our staff action plans are really the meat and potatoes. They're exactly what they are, staff action plans. It's broker responsibility, it's a team's responsibility to make sure that the staff are made aware of what exactly their job is, how they are going to help the person to meet their goals. So we want to make sure that that is clear in the plan and also, again, in line with a life plan. The staff action plans are due 30 days from the meeting. So I know sometimes we've seen trends in that the brokers will wait to the life plan to come. And sometimes now that means that we're out of compliance with our CFS policy regarding the staff action plans. So please make sure that the staff action plans are submitted within 30 days of the meeting. You don't need to wait for the life plan. If you're waiting for the life plan to make sure everything matches, your FI manager will make sure that that life plan meets your goals and matches your staff action plan. If we have your staff action plan and then that life plan comes after, we're going to make sure that they match. So you don't have to worry about waiting for them. Okay. Remember, we need 2 annual staff action plans, one of which must coincide with the life plan review. So again, just the best practice is to get those life plans, the staff action plans reviewed and updated when you have the life plan meetings. That way you're always in compliance. We always have the correct amount of staff action plans and reviews that we need. Okay. Make sure you're documenting in your meeting minutes that the staff action plan was reviewed. So when you're doing your meeting minutes, as Jen said before, meeting minutes, they are just that. They should be, anyone reading those meeting minutes should be able to get a really good picture of what was discussed at that life plan meeting. They don't need to write out tons and tons of paragraphs about it, but one life plan meeting in 2 or 3 sentences really isn't going to help someone see what was happened. It's not going to help you reference what happened if you ever need to, or anyone else. So another point, just to circle back to staff action plans, make sure that you write in those meeting minutes that the goals were reviewed and the staff action plan was reviewed. And if there are any changes or updates, please make sure that you include those in your meeting minutes. Staff action plan, best practices. So we already discussed making sure you're reviewing, making sure it's submitted on time. To go over the parts of the staff action plan very quickly, current level of performance. So that the current level of performance, just as a friendly reminder, is where the person is at right now. If they have a money management goal, maybe, Johnny is able to identify pennies and nickels, but he still needs help with dimes and quarters, or he's able to identify coins, but still needs help making change. Whatever that looks like, that's what the current level of performance is. It's the starting point. Okay. Then the staff supports and the staff methods. What activities, what actions, what prompts, what is the staff going to do to help the person meet the goal? So that's why it's so important to make sure that we have that level of performance and we have clear staff supports written. Here's where the person is, and then how are we going to work with them, right? Because ultimately the staff action plan, it's an evolving document that's supposed to update and change. So that where they're at, that current level performance at some point should change. The staff actions should change. And then hopefully we can get that person to a completely new goal. So just best practices, friendly reminders. Those are the different parts. Those are when we need everything. And as the broker with the family, remember, it's your responsibility to train the self-hired staff on the staff action plan. Make sure that they're aware, this is the goal. This is where we want to get Johnny. This is where he is. And these are all the things we expect you to complete, or they expect you to work on with Johnny to help him meet those goals. Anyone have any questions about that? Monthly summary notes. So monthly summary notes are due every month by the 10th of the month. And the monthly summary notes are only for ComHab. We only need them for ComHab because in line with the staff action plan and the person's goals, right? How do we know if the person is meeting their goals? Where do we know? How do we know where they're at? And that's what the monthly summary note is. It's a note about what actions the staff worked on to help the person meet their goals and how the person is doing with them. So remember, like I said, it's, Johnny had a great month. He, his staff got him out into the community. Well, that's wonderful. Did they need to provide any prompt? What activities did they work on? Did Johnny go from, maybe having some behavioral concerns before going out 3 times a week to now only having some behavioral concerns once a week? Those are improvements, and those are things we all hope to have and want to see. So that's the kind of information that we'd like to see in the monthly summary notes. Not just that the person had a great month, or if they didn't have a great month, that's okay too. We really want to see the progress. We really want to capture what happened that month, good, bad, or otherwise, what's going on. That way, as a team, we could know maybe there's a goal we need to change. Maybe there's something we need to update. Maybe we're seeing a trend in something that's happening that maybe we can do differently. So this is really where we want to put that information. Again, we don't need you to write a novel, but sorry, does someone have a question? Suhana?
So Marissa, I had a question. So the monthly summary notes are due by the 10th of the month for the previous month, right? That 30
Yes.
days before. And who assists the new staff with getting that done? Because I don't know who to direct them to every time they reach out to me.
Yeah, you can have them reach out to the family.
Okay.
Yeah, so the monthly summary note, we're not very particular with who does it. The staff can do them, the family can do them, the broker can do them, as long as we get a monthly summary note that has the information that is needed.
Okay.
Whatever works for the family works for
Okay.
us.
Thank you.
Yeah, for sure. It is a preference that the staff do the note, because the staff is the one who's actively working on the goals with
The
participants.
goals, yes.
They're the one who's really, on the ground doing the work. So their perspective would be best. If the person they support is in a position where they can participate in that note writing process, that would be great too, to have that person say, my staff helped me do A, B, C, and D, and I feel A, B, C, and D about this. That would be wonderful.
Yes.
Again, however we can make it work is fine with us.
Okay.
Yeah, so that's really what we want to see there. Now, we also understand there's lots of ComHab in a budget, but maybe that person doesn't have staff. That's okay. Because ComHab is in the budget, we do still need a note. We are still required to have a note. A simple sentence, Johnny has not yet identified a ComHab staff. We're still looking. Or Johnny is not interested in staff at this time. He expects to find staff during the summer, or whatever the situation is fine. Just please document that, because if the person has ComHab in their budget, it is expected they're receiving ComHab services. We all know staff can be hard to find. Maybe in this season, the person's in school. Right now, they're going to look for staff in the summer, or whatever the situation is or isn't. Again, that's fine. We just need to make sure that we document it, right? Because we all know we're in this field, right? Documentation is important. So the state's going to want to see, well, if they have ComHab, where's the note? What's going on? And again, it's also looking at trends, seeing what we can do differently, what they can do differently, how we can help. So that simple sentence about why the staff is not receiving the service at this time is fine to meet the requirement for a monthly summary note.
Okay.
Anyone have any
Thank you, Marcy.
questions?
Thank
Sure.
you.
Okay, great. Thank you, everybody.
Thank you. Thank you. Grace, and if you're all set, we'll pass it on to you for project management updates.
Okie dokie. Good morning, everybody. So the few projects that we wanted to talk about today, one of them being school age projects. So we added on here the procedure manual, and on page, I think it's page 26 or 27, and it'll tell you what the rules and regulations are with regards to school-aged children when it comes to having staff working with them. So the federal rule is basically that when a child, a person cannot use waiver services during educational hours. So simply said is that while a child is in school, they cannot be using self-hired staff. Okay, so we're working on putting a survey together, which will be sent out probably towards the end of the month. We wanted to work on this project during the summer. That way it's easier to make the adjustments and collect the schedule. So what's going to be happening is the standard schedule that will be set up in Avero will be from 8:30 to 2:30. No, wait, hold on. I have the
Yeah,
wrong
8
time.
a.m.
8 a.m.
to 2:30.
to 2:30, right?
Mhm.
And so that'll be set up in Nivero. So if there is someone that specifically has a special circumstance, such as they go to private school and their schedule is different, I'm going to ask for that school schedule. I've already done it with a few parents that have given me that schedule, and I set it up in Nivero. If they're homeschooled, that schooling is going to be different. It might be in the afternoon, so we need that documentation from the Office of Homeschooling. So that way I can set up in Nivero what their schedule is specifically. Having said that, if a staff will try to clock in during those times, they will not be able to. Because in certain cases, let's say a child's homesick or it's a snow day, again, those would be considered school hours. So they will not be able to clock in during that time. The only other option, if available, would be FRR, in those cases, but they would have to contact their FI manager and see if that's available. So that's something that's coming down the pike to get it more structured. And we're using the DOE days off holiday schedule as school closures and such. So if you have any questions, let me know. I am the point of contact, so if you have any questions along the way or anything comes up, just please contact me. No problem. Any questions? No? Okay,
Grace, Cynthia has a question.
sure.
Yeah, I have a question. Just wanted to clarify for holidays and spring breaks, like school breaks, is that changing the calendar schedule in Ivero?
Yeah, I do that, yes. So for example, spring break, I had it all for the students that I know currently, because like I said, this is a project that's coming down the pike. I had everything, school closed, listed on there so that staff, when they go to punch in, they can punch in without a problem. But as we continue with this project, they'll see, the restrictions will be set up. So that's why it's very important for when this survey goes out that the families respond. So that it can be set up. And then along the way, of course, we'll make adjustments, and if they contact you, at least you know what's going on,
Now,
I mean-
is there a form that we can, let's say that, for instance, we discovered that the schedule for schooling has changed, especially for homeschooling students, which that happens often. Is there a form, something that we can complete and send it over to you, or do we just send an email and put you on it?
Yeah. Currently, as we start the process, we'll see. If I feel like we need a form, then we'll prepare a form. But at this point, I want to get the ball rolling at some point in June, see how the response is. Because if they go to private school, there's going to be a schedule already, of days off and holidays. And already I've been using a few as a test pilot. And then you could just email me whatever it is that we're working. Now, home instruction, I know that there's usually a form that they sign when the teachers come to the house and they put the schedule together. So that's what I'm going to be looking for, some type of documentation that says this is when they go to school.
Not all the homeschooling has teachers coming in. There's families that choose to be there.
Okay,
provided.
and then we'll have to, those are special circumstances that can be discussed as we go through the process. Obviously, if they have approval for homeschooling, because home instruction and homeschooling are two different things. So, if that's the case, then we'll discuss it, and that's it. We just need to make sure that families understand that staff cannot work during standard school hours or school hours, generally speaking, So that'll be coming down the pike. If any questions, just let me know. Secondly, provisional eligibility. Now, some of you have received emails from me. So on a monthly basis, I am looking through anyone that is not eligible or is in provisional status or being reviewed. So I'll reach out to the circle of support and let them know, hey, do we have any updates? You know, especially starting at 7 years old. 7 years old, now I will begin to sending out emails with the policy, letting families know, hey, it's time to reevaluate. And the care managers are the ones that are responsible for making sure that they're doing what they're supposed to be doing. And on bottom page of 26 and 27 of the same policy and procedures manual, you'll see exact details. So I'll email you. You know, I know sometimes it's annoying. I'll be like, any updates, but it's my job to make sure that we stay on top of that, you know, and then I have a tracker, which I keep track of, because sometimes things don't get done by the time they're 8 years old. There might be, you know, a delay in some way. And, you know, as long as I keep it on the tracker and we're aware, we should be fine, you know. And I think that is it on the provisional. Does anybody have any questions about provisional status?
Ken had a question. They asked on the eligibility, are they providing a reason or is it just a common reason for eligibility concerns?
In what I don't understand the question.
Yeah.
Provisional status is something. Do you
Mhm.
know, Jennifer? Okay.
Yeah, it varies, but the typical reason for why a child may not be found eligible is they're deemed to not meet the, what is the word I'm looking for? To not meet the criteria of a child with an intellectual or developmental disability. Not
Right,
enough of a diagnosis, you know. So that opens up for a potential fair hearing for reevaluations. Okay.
Yeah, and
Um,
also this is Cynthia. It's sometimes
Mhm.
it's just like it doesn't meet the level of care, which that would
yeah.
bring you into a fair
Yeah.
hearing.
And we've seen, as of lately, we've seen at least maybe a couple of individuals where it has been, you know, which have maybe at least one deemed eligible right after the sets of evaluations have been reevaluated, and one who was not, you know, and so, but they can always reapply for waiver services, and so know this, you know, if you ever, if there's an unfortunate situation where as a broker, some of you may be sitting here where you have had to experience this with a poor family where they are not deemed eligible, you know, went through the fair hearing, they can always reapply again for OPWDD services. So just know that they can. So, but yes, as of lately, those are the trends. So I'm sorry to cut you, Grace. I don't have the
No,
trends.
that's it. So that you'll see, and now all of you, most of you, if you have any individuals that are provisional, you've been seeing the emails from me. We just wanted to touch base and say, hey, this is the process, this is what we're doing, because we need to stay on top of it, bottom line. And then the last part is transition stipend. Those are depending on individuals that have housing that might have that transition stipend. I prepare the documentation, I forward it to the people that need to approve it, and we wait for reimbursement. But we're finding that there's a delay in the reimbursements of these stipends. So we've decided to process it and pay the families and then wait for reimbursement from OPW. So that is really a simple process.
Yeah. So the good news there is we'll upfront it for families. The risk is we hope to get paid. So we can only hope. But so I guess that's good news, you know, we could give for families. And really we see this more in Region 4, no pun intended there. So that's really where we see a Region 5, we, you know, no complaints there. Real quick before I shift away from this, just to back to the school age project, feel free, team, you know, brokers, to email Grace and I, because as we start to roll this out, all feedback is welcome. This is a good feedback, and so far from what I'm hearing from Cynthia, this is good because while we have 8 a.m. to 2:30 here, we do, just so everyone knows, we do have to update the policy and procedure. We do have a school age policy and procedure, and truthfully, we kind of just mimic this from what's out there in the ADM. All the ADM says is school age, whatever that means. we we had something in there, I think 8:30 to 2:30, but in the trends and what Grace has piloted over time, we know that there's self-hired supports out there that actually help families get, especially the school age children. And I say children because we have high schoolers, we have, but more like the children get on the bus and get to school or out of school. So we wanted to make sure we capture the early 8 a.m., the 2:30s. So that's where the 8 a.m. to 2:30 is coming from. I think in the policy we have it to 2 p.m. So we wanted to do like a 8 a.m. to 2:30. Just so that you guys can visualize this a little bit, think of this Evero setup as the remote brokerage, where once we had to turn on that telehealth eligibility, if you're unable to do your broker billing via telehealth, it's because it's not turned on. Think of it for self-hired. Once this 8 to 2:30 flag is on and they try to punch in, it won't let them during school hours, right? So what'll happen is we have to have it this way, because if we went in for 600 employees and just customized it, there's no manpower for that. But to pointing out Cynthia here as a good example, we will be able to have those special circumstances because we should be able to. Every situation is not the same. But that's where we have to work with the FI managers and the circle of support, with the homeschooling, with the those folks that are homeschooled. We may have the private schooling, to Grace's point. We understand that middle schooler as opposed to a high schooler, we understand those situations are their special circumstances. And we find that it's probably going to be just like the brokerage, telehealth, quick little influx, and then it'll settle down. We suspect that that's probably what's going to happen. And then it'll probably die down. And so far the trends, it's not but a select few that we tend to catch that do, the school hours when they're not supposed to. And again, like I said, this is when we find that it's retraining for families, because we realize this. There's just too many rules, regardless of self-direction, and families don't always know this. So this is truthfully always a time to retrain and explain to families. And while this is not always great news, we are charged with having to be the bad guys a little bit and train and teach them this kind of stuff. And this is also where we have the support of Noemi now, when she runs payroll and picks up on these things. So therefore we balance each other, right? So as we roll this stuff out, please, we welcome any feedback or input as we roll out that project. Okay.
And if I could just add additionally, on that survey for this year, I'm going to be asking who's in school during the summer. That's a big deal, because right now the schedule's in for the summer. So if a student is not in school during the summer, then I need to cancel out that schedule so that the staff could clock in during that time. Right. So that'll be added onto the survey for this time around, since it's the first time. Then going forward, I might just send out a quick form, Microsoft form, saying, is your child in school during the summer? Depending on their IEP, if they have a 12-month or, and they're off during the summer. So that's another important thing that I'm going to be looking for, so I could set it up properly. And then the last thing I forgot to add, in Evero, in the portals, families, and I'm not sure, I think brokers can too, view the school schedule. So they're able to see how it's set up in the system. Because in the few cases of where I put in individuals' private school schedule, I asked the families to go into the portal and look and see if I did it correctly, just so that they know where to look in the case there's a problem with a staff member. So they'll be able to see it, but not do anything, and if they have any questions, they contact me or contact you, or, the message will get there. But
yeah, we'll be sure to do. We'll be sure to do communication training, brokers. There's, no reason for this. Will not just have to be a family thing. Brokers should assist. Absolutely.
Yeah.
And
all that
electronic. Yeah.
And all that information will be in the document we're sending out, how to get to the portal, where to find it. So I'm just letting you guys know so you're aware, but all of that will be in the memo that we sent out, that we send out. And that's all I have. If you have any questions, let me know, reach out, whatever.
Thank you, Grace.
You're welcome.
And just our last few final slides, we did have a very tiny family meeting, but thank you for the few that joined. It was, we had steps to health educators. So these links will be, I'll be sharing these slides for anyone interested in sharing this out to families. This is a study being done by professors through the CUNY for this was when did we do this? I think this was last week. I shared the recording. Yes, I did share the recording
was
last
last week.
week.
It was
Last week, yes, thanks, Ati. Yeah. So the form, and I did put the form here for folks that are interested. It's a Google form, and there is compensation. We had one of our very own self-advocates. He's great, Jeff. And so, but again, it's only for 16 to 27, but which we wish it was beyond that, because they are very resourceful and a very nice set of folks there. So I encourage you guys to check it out. And we hope very soon to start. We do have a lot of updates, so we hope to start to very soon get a monthly newsletter as soon as next month. So look out for that. And I did more of a visual person. So was there a question? I'm more of a visual person, so I don't know if you guys know this as brokers, but Ivero did share that the development team did share that there's some functionality to the Ivero mobile app where brokers can now initiate telehealth sessions from your broker service documentation. Are you familiar? I don't, okay. But so I guess from your devices, if you have the Avero mobile app, you can actually from your app, well, I have the screenshots there, and then on this slide here, if you click into that link, you'll see the PDF and it'll walk you through the step by step. But since I'm more of a visual person, I screenshotted my app for you all if that's more useful to you. So I brought myself to the app, brought myself to broker services, just highlighting it here, my test girl Casey as my individual, and then I went to service documentation. So what you do is if you click that plus sign as if you're doing service documentation, let me go to the next slide. You can actually, as if you were a self-hired employee, if you click that start, that like that play icon, it starts a session. So think of it this way, like if you were in a life plan meeting and you just hit play and you just sat through your life plan meeting and typed your notes as if while you were in that meeting, it would just, and then you click this like stop. It's as that it just kind of, you're just in session, you're in the telehealth session. That's what it does. What I thought, and maybe what I thought it did is I thought it also kind of, it didn't, this was wishful thinking. I thought it also had the video component of it, but maybe that's a good that may be good feedback for Ivero. I don't know why I thought it had that, or maybe it does, and I'm not there yet. So this is, but it's a good start.
Jen, I
But-
just have a question. You can only access the platform through the app, or you can access the documentation tab through the computer as well, like if you're having a meeting.
The way when I clicked into this link, it was through the app. It was only through the app.
What-
Yeah, but play around with it, because I'm I'm no
Let me-
expert, but I emailed them directly. It was through the app, the way they
Okay.
explained it to me. Yeah, through the Ivero mobile app. Yeah. So
There
but,
is a very important question on the chat
Mhm.
that Donna posed.
Mhm.
If you can like talk about
Let
that.
me stop sharing so I could go to the app, the chat, guys. I'm getting to you, Don, in a second. Section 8 wait list. Section 8 wait list, that's the button? Oh, this is for the housing subsidy to reapply and present confirmation. I want to quickly say yes. So here's why, but I will revisit the ADM on this. I have to relook at the ADM on this. It's all on what the ADM says, right? If the ADM reads that we need, where's my housing navigators? If there's
I
if the
don't
ADM,
think it does. I don't think it says that if
yes,
it's
where's my
reopened,
housing?
you have to.
Right, that's it right there. If the guy, well, it just, I have to relook at the guidance, right? Do we need written confirmation that verification? I know that we have to reference the life plan and justification of that, what efforts and resources have been exhausted, but I can get back to you. But the requirement, I don't know that section 8 is, I don't know. You said page 2? Huh. It is written on the guidance, she said. Well, let's get back to you, Donna. Let's get back to everyone, actually, when we do the recap email.
I unmiked, I unmuted myself, but I mean, here's the thing, I think definitely for anyone that is currently applying that, they have to apply for Section 8 if the waitlist lottery is open, but for those that already have it, we've been taking a screenshot of the Section 8 page and showing that the waitlist lottery is closed and saying on all the documents that they will apply if it reopens.
But you're saying for folks that already have the
Yes.
subsidy?
Right, active
Yeah.
housing subsidy.
So the question is, do we have to reach out to all the people, have them reapply, and then send you a confirmation that they reapply? That's what we did when it was open last time. Was that in 2022? It was open for a week, and I think it's going to be open just for a few days in June.
The 3rd to the 9th, I believe.
Yeah.
Of what, June?
June, yeah.
Is this just for is this all of that New York State?
Only New York City, I
Yeah,
believe.
New York City. It hadn't been open for 16 years prior, so we figured, it's not going to be open again. And I think they got like 300,000 applicants at that time, and they only had like 10,000 numbers. So why are they, reopening again? But I don't know.
That's a good question. I wonder if in 2022 this was around recertification period.
Just to make work for us, Donna, that's why.
Billable work. But yeah, I can get guidance on that. So wait list and confirmation. It's a good question. Definitely do not know, but I can get confirmation and I'll relook at the ADM. What other questions? Let me screenshot this so I don't forget. Oh, and I see Ken, you're here. I wanted to highlight and thank you for I forgot to mention Ken for his efforts in bringing us together with Coalition and making that happen.
Jennifer and Lori wanted to talk a little bit
And-
about the SD connection.
Yes, and Lori, before you jumped on, I just want to say that Donna here had a lot to say about Dr. Y. Her son had so many things to say about you and the wonderful feedback, but I'll let her tell you that. And you let us know how that's going, even though we heard from Donna's son how that's going. So take it away, Lori. Oh, you're muted. Am I able to unmute you? Let me see. Let's see. I can't unmute you, Lori. I don't know.
Oh. Oh, wow. You know, while Lori's trying, I will just say that my son is participating in, yes, he calls her Dr. Y's sustainability project, which as an aging parent, this is a very hot button for me. And I've heard a lot of talk about it, but this is the first thing where the rubber is meeting the road and is really helping, because I'm very concerned what happens. You know, I'm doing all of the paperwork. It's very, very complicated. My son only uses self-direction. He doesn't use any agency programs. He's an adult, so his monthly paperwork is extremely complicated. And who would be able to do it if something happens to me? People are dropping like flies. So, you know, this is really, Lori has really working with a pilot group of siblings to teach them self-direction. And she is an expert in self-direction and a college professor. So she knows how to talk to these siblings. They, you know, if I try to teach my son, I don't think he's going to listen to me. I'm the mother. But he listens to Dr. Y. He became a designee on my son's plan. He did the monthly paperwork. He's attending the life plan meeting. He's interested and excited about self-direction. And CFS, you know, this is remarkable. I hope you get funding and expand this, because I work with all adults and I know everyone is in the same sinking boat. The boat is sinking. We're getting old. We need a plan to pass the baton. So that's, meanwhile, Lori, you can't unmute yourself. So I'm trying to fill in some blanks about what's going on with this. This is
just
not,
as an addition to what Donna is saying, Seawright, Assemblymember Seawright, who chairs the Assembly IDD committee, has put forward, and the bill has passed. To create a commission to deal with this, to actually explore what system sustainability would look like. And FYI, the bill is A09553. So it's passed the Assembly. I would expect it's going to pass the Senate, and whether or not the governor will sign it is quite another matter. Co-sponsors were Zinnemann and Burdick.
Can you say that bill number one more time? I'm sorry, Ms. Ludo.
0955. Let me put it on
The
there.
bill number
Zero what?
is
Yeah.
A as in assembly, 09553 alpha.
Thank you.
Actually, you don't need the alpha,
Yeah.
just 553.
I'll share that with
I mean,
everyone.
CFS has been doing a lot of work with sustainability focus groups. I participated in one of the focus groups, gathering data, feedback, and doing presentations to different parts of the community in a really effective way. Lori and Linda are like a tag team, and they have interesting things to say. If you haven't seen their presentation and you have a chance to, I highly recommend it.
Any chance I'm unmuted?
Yep,
You're
you're
I
muted.
think so.
Great. So thanks for the feedback. It's very gratifying. Of course, now my dog's going to bark, so you can't hear me. Jimmy, come here, honey. So the main thing I wanted to share, and Donna, thanks, you covered things so well, is that we are now, because it's been going well, Linda has given the okay to open up referrals for people who want to include participating in the connection groups. I think sustainability project's another good name for it. So in IDGS, there's a line item for coaching and education for parents and advocates to learn about how to support the person through self-direction. That's exactly what this group does. And it will take a few months because you would need to add it into the self-direction budget. There's a max of $500 in that line. But if we get enough people, I would say each group 6 to 8 is about what works because it's very interactive and very individualized. But it's only once a month. I mean, it's once a month for a year, so it does take a commitment, but it gives people a chance to do some follow-up in between the sessions at a pace that I hopefully is not overwhelming. So for the brokers who are participating in today's meeting, I'm hoping that you'll consider what families you're working with who either have siblings or close friends of the family who are in a younger generation who would be interested in stepping up to help take over the reins eventually when parents are no longer able to. And we can start taking referrals now. And Jennifer, you can talk about, and I think Grace helped with a link on the CFS website. There's a short intake form. It's
Yes.
very short, just so I can have some very basic information and then I can follow up.
Yeah.
So I don't think that I'll be starting another group over the summer, but it would be good to get started. Like as long as the person's really eligible and understands about the kind of commitment that it takes, you could at least start working on the budget and including it in the budget. So that's like the next new step. So we don't have to necessarily wait for additional funding, from a foundation or, et cetera. We really, there's no reason to think it can't get funded through the self-direction budget at this point.
And Lori, just so you know, the link is still available. It is open. So, and I haven't seen anything come through yet, but if anyone is interested and needs the link, let me know. And then Lori, I'll refer those documents to you so you can keep track of the people. But
Oh,
right
great.
now,
Yeah, great. I mean, we really haven't publicized it because
Right.
this is
Will we share
very,
will we share the
recent.
email? Yeah.
Yeah.
Will
Yeah.
we share the link? I mean, I'm sorry, on the on this recap email. And there was a good question, which I think I know the answer, but just to confirm, Lori, this is open to outside our SDS families. Yes.
It is. Yes. So thank you.
Thank you. So this is good. Thank you. Thank you. And highlighting, by the way, Cynthia, Mr. Ludolf, Dr. Y, our advisory committee members. So thank you. Thank you always for your contribution. Ken, I think we have Ken, who's also one of our newest. Ken, you're somewhere, right? One of our newest advisory members. Always on the back scene somewhere, multitasking, but yes, okay, yep, I said it, multitasking. I see him on the chat. So that is all we have for today. I always, as usually, hang around if anyone needs one-on-ones with me, answer any questions. But that is all we have for today. I'll stop recording. Thank you all as always, and I hope to see you